Delirium. Delirium essential features. 1. A disturbance of attention, orientation, and awareness developing within a short period of time, for example, within hours or days, typically presenting as significant confusion or global neurocognitive impairment with transient symptoms that may fluctuate depending on the underlying causal condition or etiology. 2. The disturbance represents a change from the individual's baseline functioning. 3. Delirium may be caused by the direct physiological effects of a medical condition not classified under mental, behavioural or neurodevelopmental disorders, by the direct physiological effects of a substance or medication, including withdrawal, or by multiple or unknown etiological factors. 4. The symptoms are not better accounted for by a pre-existing or evolving neurocognitive disorder, i.e., amnestic disorder, mild neurocognitive disorder, or dementia, or by another mental disorder. 5. The symptoms are not better accounted for by a typical syndrome of substance intoxication or substance withdrawal for a substance or medication that is known to be present, although delirium can occur as a complication of intoxication or withdrawal states. Additional clinical features of delirium. 1. In delirium, cognition is typically impaired in a global manner, such that multiple areas of neurocognitive functioning are impaired upon assessment. 2. Delirium may include impaired perception, which can manifest as illusions, i.e., misinterpretations of sensory inputs, delusions or hallucinations. 3. Delirium often includes disturbance of emotion, including anxiety symptoms, depressed mood, irritability, fear, anger, euphoria, or apathy. 4. Behavioural symptoms may be present, for example, agitation, restlessness, impulsivity. 4. A disturbance of the sleep-wake cycle, including reduced arousal of acute onset or total sleep loss followed by reversal of the sleep-wake cycle, may also be present. Course features. 1. Onset of symptoms is typically sudden, for example, within hours or days, with a transient and/or fluctuating course. 2. Symptoms are generally expected to remit with treatment of the underlying etiology or the elimination of the causative substance from the body. Developmental presentations. 1. Susceptibility to delirium in infancy and childhood may be greater than in early and middle adulthood. 2. In childhood, delirium may be related to febrile illnesses and certain medications, for example, anticholinergics. 3. Older individuals are especially susceptible to delirium compared with younger adults. Boundaries with other disorders and conditions, differential diagnosis. 1. Boundary with dementia. Delirium is differentiated from other neurocognitive disorders in that the former is characterized by global neurocognitive impairment, and confusion that have a precipitous onset, are transient, and fluctuate depending on the underlying causal condition or etiology. Dementia is more typically characterized by impairment in specific neurocognitive abilities and is often progressive and more gradual in onset. Individuals with dementia are at increased risk for delirium, and those who develop acute disturbances in attention, orientation, and awareness should be assigned an additional diagnosis of delirium, and evaluated to determine its specific etiology. 2. Boundary with neurocognitive impairment associated with acquired or traumatic brain injuries. Delirium is differentiated from an acute confusional or agitated state related to acquired or traumatic brain injuries by the absence of evidence of a preceding neurological injury or event, for example, traumatic brain injury, cerebral hemorrhage, stroke. 3. Boundary with transient global amnesia. Unlike delirium, transient global amnesia is characterized by the presence of isolated memory impairment alongside intact functioning in other cognitive areas, for example, naming skills, self-identification. 3. Although both disorders may present with memory impairment, delirium is frequently characterized by additional symptoms including significant confusion, global neurocognitive impairment, and behavioral and emotional disturbance, for example, hallucinations, agitation. 4. Boundary with factitious disorder and malingering. In factitious disorder and malingering, the neurocognitive symptoms characteristic of delirium are consciously feigned. Feigned or induced symptoms may be, though are not necessarily, atypical in pattern, magnitude, or course, or may be medically implausible. Individuals with factitious disorder feign neurocognitive symptoms in order to seek attention, especially from health providers, and to assume the sick role. Malingering is characterized by intentional feigning of neurocognitive impairment for obvious external incentives, for example, disability payments. 5. Boundary with schizophrenia or other primary psychotic disorder. Delirium accompanied by hallucinations and/or delusions is differentiated from schizophrenia or other primary psychotic disorders by the absence of other characteristics of these disorders and by symptoms that are transient and fluctuate depending on the underlying causal condition or etiology. 6. Boundary with dissociative amnesia. Selective memory deficits are present in dissociative amnesia, and may be accompanied by confusion about identity if dissociative fugue is present. Dissociative amnesia is not characterized by disturbances in attention or awareness, general confusion, or global neurocognitive impairment, which are features of delirium. Categories or types of delirium. Delirium includes the following categories. 1. Delirium due to disease classified elsewhere. 2. Delirium due to psychoactive substances including medications. 3. Delirium due to multiple etiological factors. 4. Delirium, other specified cause. 5. Delirium, unspecified or unknown cause. For presentations characterized by a disturbance of attention, orientation, and awareness developing within a short period of time, for example, within hours or days, and whose cause is identified but is not adequately captured by any of the other available delirium categories, the following diagnosis may be appropriate: 6070.Y delirium, other specified cause, and 6070.Z delirium, unknown or unspecified cause. 6070.0 delirium due to disease classified elsewhere. All definitional requirements for delirium are met. There is evidence from history, physical examination, or laboratory findings that delirium is caused by the direct physiological consequences of a disorder or disease classified elsewhere. Potentially explanatory medical conditions. Examples. 1. Certain infectious or parasitic diseases, for example, meningitis, viral hepatitis, sepsis. 2. Diseases of liver, for example, chronic hepatic failure, hepatic encephalopathy. 3. Diseases of the circulatory system, for example, acute myocardial infarction. 4. Diseases of the nervous system, for example, cerebral ischemic stroke, epilepsy or seizures, hypertensive encephalopathy. 5. Diseases of the urinary system, for example, kidney failure, urinary tract infection. 6. Endocrine disorders, for example, diabetic ketoacidosis, hypothyroidism, hypothyroidism. 7. Metabolic disorders, for example, acidosis, disorders or urea cycle metabolism, hypoglycemia, hypomagnesemia, hypoosmolality or hyponatremia. 8. Neoplasms of the brain or central nervous system. 9. Nutritional disorders, for example, vitamin B1, B3 or B12 deficiency. 6070.1 delirium due to psychoactive substances including medications. All definitional requirements for delirium are met. There is evidence from history, physical examination, or laboratory findings that the delirium is caused by the direct physiological effects of a substance or medication, including withdrawal. If the specific substance inducing the delirium has been identified, it should be classified using the appropriate subcategory, for example, alcohol-induced delirium. Types of delirium due to psychoactive substances including medications: alcohol-induced delirium, cannabis-induced delirium, synthetic cannabinoid-induced delirium, opioid-induced delirium, sedative, hypnotic or anxiolytic-induced delirium. Cocaine-induced delirium, stimulant-induced delirium including amphetamines, methamphetamine or methcathinon, synthetic cathinon-induced delirium, hallucinogen-induced delirium, volatile inhalant-induced delirium. MDMA or related drug-induced delirium, including MDA, dissociative drug-induced delirium including ketamine or PCP, delirium induced by other specified psychoactive substance including medications. Delirium induced by multiple specified psychoactive substances including medications, delirium induced by unknown or unspecified psychoactive substance. D70.2 delirium due to multiple etiological factors. Essential, required, features, all definitional requirements for delirium are met. There is evidence from history, physical examination, or laboratory findings that the delirium is attributable to multiple etiological factors, which may include disorders or diseases not classified under mental and behavioral disorders, substance intoxication or withdrawal, or a medication. Thanks for watching. Please like and subscribe.